Hello, everyone, and welcome to this webinar on choosing safer sanitizers and disinfectants and what purchasers need to know. My name is Susan Alpo from OSD, also from OSD's Miriam Stein, and she'll be monitoring the chat this afternoon. And just some housekeeping. As you saw, we are recording this presentation. We do ask that you keep your webcams off and audio on mute unless presenting. And just a reminder that state policy does forbid the use of AI-based transcription or recording devices by any participant in Commonwealth calls. And please submit questions using the chat feature. We will respond to all questions at the end of today's presentation. And tomorrow I will forward a copy of the presentation and a link to the recording to all attendees. And now I'd like to welcome Julia Wolf. She's our Director of Environmental Purchasing here at OSD.
Hello, everyone, and welcome. We're really happy to have you all here joining us on this webinar. So I'm Julia Wolf. I'm Director of Environmental Purchasing at the Commonwealth of Massachusetts Operational Services Division, or OSD. And for those of you unfamiliar with us, we're the state agency that establishes and manages master service agreements for goods and services available to all public purchasing entities in Massachusetts. So other states, and I know there are folks from other states tuned in today, other states may use our contracts as well. So please reach out to us if you're interested in learning more about using our contracts. So I help administer Executive Order 515 in Massachusetts, which requires agencies to purchase environmentally preferable products and services, or EPPs, whenever they're readily available, meet satisfactory performance standards, and represent the best value for the Commonwealth. And we also help establish standards for cleaning chemicals, sanitizers, disinfectants, and janitorial paper products under our statewide contract, FAC 118. And you're going to hear more about that contract today. So our focus today is safer sanitizing and disinfecting. And I'm pleased to introduce our three speakers. We have Emily Sparrow-Fine, who is the Director of the Massachusetts Department of Public Health's Occupational Health Services Program. And she's going to discuss why healthy sanitizing and disinfecting practices matter to our well-being. And then we'll pass it over to Alicia McCarthy. She is a Senior Safer Chemicals Scientist, an adjunct professor at the Toxic Use Reduction Institute at UMass Lowell. And she will share real practical guidance and tools for safer cleaning and disinfecting. And this will actually be sort of the bulk of the presentation today. Then we're going to turn it over to Tatiana Henry with a brief interlude there with me speaking just for a couple of minutes. But to talk about FAC 118, so Tatiana is our FAC 118 category manager at OSD, and she's going to walk you through how to find and purchase safer sanitizers and disinfectant products on this particular contract. So if you have questions, please post them in the chat and we'll address them following the presentation as time allows. So without further ado, I'd like to introduce Emily.
Thank you so much. And thank you everyone for being here this afternoon with us all. We're excited to be here. And I want to start by just giving a quick shout out to my colleagues who are listed on the slide, Michelle Pacheco and Kathleen Fitzsimmons, both at the Department of Public Health. And they really lead this work on work-related respiratory disease. And a lot of the content that I'm sharing is there. So thank you to Michelle and Kathleen. Next slide. So when we talk about why healthy sanitizing and disinfecting matter for our health, I think it's important to start by understanding some of the health impacts. And the biggest impact that we see is really on our respiratory health. And so I'm going to start by talking about asthma. It's one of the most common respiratory diseases. And so first, let me explain what asthma is. Asthma is a chronic inflammatory lung disease that can make it really difficult to breathe. Common symptoms of asthma include inflammation and narrowing of the airways of the lungs and excessive mucus production. This can result in wheezing, coughing, difficulty breathing. Episodes of asthma, known as acute asthma attacks, can be triggered by common things in our environment, such as dust, mold, tobacco smoke, different chemicals, such as cleaning products. And asthma affects more than 22 million adults in the US. Work and what we're exposed to at work contributes to this burden of respiratory disease, such as asthma, but it's often under-recognized. And when I refer to work-related asthma, I'm referring to asthma that's caused or made worse from exposures at work. And this can have a real impact on people's lives. And so understanding how work contributes to the overall burden of asthma can really help inform prevention efforts. Next slide. Okay, so I'm going to share a couple of slides that are very data heavy, but bear with me. I'm going to walk you through it. And the slides will be shared after the webinar, so you can look more closely at this data. And like I said, I'm really going to try to help focus your attention on the big picture takeaways here. I'm also happy to give some background information. Would folks mind just muting yourselves? Thank you. And I'm happy to, after I finish talking, put some of these links to where this data is posted in the chat, so you can look on your own. So first, I just want to acknowledge that this data that I'm talking about, one of the key takeaways from this data, which is that among adults who've ever been employed, approximately 44% of those, or almost half, report that their asthma was caused or made worse by their job. It's a lot of people. And so now I want to draw your attention to the graph. And so here we see the percent of people who are reporting various asthma-related impacts in their day-to-day life. You'll see two color bars. The blue, the darker one, represents those people who report having work-related asthma, and the gray are those that have non-work-related asthma. And so the key takeaway here is that adults with work-related asthma were more likely across the board to report more frequent asthma symptoms, more sleep disturbances, more asthma attacks, limitations to their usual activities, more emergency department visits or urgent care visits, compared to those with non-work-related asthma. And so I want to draw your attention to this difference to highlight that those with work-related asthma have overall worse outcomes. And so another way to think about this is to really, if not for work and what folks are exposed to at work, they may or may not have asthma or as bad of asthma symptoms. And we know that nobody should be getting sick from their work, and that these exposures at the workplace are preventable. And you all here play a really important role in helping do that. Next slide. So one more detailed graph. This is what's shown on this graph is really getting at what we think is causing the workplace exposures to work-related asthma. And so we have data at the health department that examines the specific exposures of confirmed cases of work-related asthma, what those confirmed cases identify as contributing to the asthma. And so the key takeaway here is that cleaning and disinfectant products are the most frequently reported exposure among these cases. And I just want to note that this highlights a really strong example of something that we call convergence in public health practice. And this is the concept of the health concerns of workers and the broader public really clearly intersecting. So for example, in schools, daycare settings, other public settings where cleaning products pose not only a risk to teachers and staff, but also to children. And you can see that parallel in healthcare settings and other settings where you have workers and the public enter, both in those settings. And so this really makes this not just an occupational health issue, but a much broader public health concern. Next slide. All right, so now I'm going to share a couple of examples of real cases that we have seen and documented here at the health department. Our first case will go back to 2020, to the early days of COVID, when there was a lot of misuse of cleaning and disinfecting products. And so this was a case that we learned about where there were two town maintenance workers who developed severe breathing problems after there was some improper use of disinfectant sprays. And this was, again, related to increased cleaning efforts during COVID-19. Their symptoms got worse over time, with one experiencing shortness of breath and severe coughing and wheezing. And these were in settings where there were other town employees, such as firefighters and police officers. And several of those firefighters and police officers also noted that they had developed symptoms from this overexposure to disinfectants. Next slide. So now sharing another case at another time. This is a little bit about a woman. This was a case from a woman in her late 50s who worked in a hospital setting as a housekeeper. And she regularly used cleaning products as part of her day-to-day that contain phenols and quaternary ammonium compounds. And she noted that her symptoms got worse throughout the day and throughout the work week. And whenever she was away from work for prolonged periods, her symptoms seemed to go away. This is a really clear sign of work-related asthma. Next slide. So now I want to close with something that we call an inhalation injury. This is not a work-related asthma case. This is more of an acute exposure and an outcome. And this is a really tragic case. Made the news. You may, as I tell the story, you may ring some bells. You may have heard about it. This was a couple years ago. There was a restaurant worker who was trying to clean something in the kitchen, and they mixed a couple of incompatible cleaning products. One was bleach, one had bleach in it, and one was a strong acid. This immediately gave off a really irritating yellowish vapor, and folks pretty quickly recognized that something was wrong, and they evacuated the building, employees and restaurant patrons, but the manager stayed behind to clean up. And sadly, he was quickly overcome by the fumes and unfortunately passed away. So this is an extreme case of what can happen when you mix incompatible chemicals. And there's some really important lessons here that we try to lift up. Next slide. And so that brings me to what all of you can do. And the rest of the presentation is really going to go into depth on the Clean Air Solutions database and the statewide contract that have some excellent resources to help avoid some of the cases and the data that I described. But I want to just highlight a couple of really important things that I think are critical to emphasize. And that is just to, really ensuring that any equipment, application methods, the chemicals that you're using, that they're compatible with one another and they're used according to manufacturer's instructions. And a key way to ensure this is to develop and follow a hazardous communication program, making sure that all safety data sheets are kept on file and easily accessible, that employees are trained on what they're doing, and there's written safety procedures for all job tasks, and that any kind of PPE is appropriate for the job. And there's tons of resources on how to develop and implement a hazardous communication program. And I'm happy to share some of those resources if folks have questions. So with next slide. This is just some contact information. Again, you'll have these slides. You can get in touch with us. And next slide. And I will turn it over to Alicia McCarthy. Thank you.
Great. Thank you so much, Emily. Hello, everyone. So today I'm going to be talking about methods and really in practice things to consider to help you with your decision-making process. We know that it can be really overwhelming to find safer alternatives, and we'll go over, like we said, about the FAC 118 and how that can be a really great resource for you to be able to identify safer options. But I'm excited to kind of talk about what we do at Turion and how you can use those methodologies. Next slide. For those of you who aren't familiar with the Toxic Use Reduction Institute, we are a state organization that's non-regulatory that's located at UMass Lowell, and we came about in 1989 due to the Toxic Use Reduction Act of Massachusetts. We're one of 3 organizations underneath that: the Department of Environmental Protection, the Office of Technical Assistance, and then us. And these are just some of the things that we do and are mandated to do, especially around training professionals on how to do what's known as a toxic use reduction plan that helps them identify what options they have for replacing whatever chemicals that they're trying to replace, if it's feasible, but they don't actually have to enforce it. It's more of just hoping it guides them in that process. But where I work specifically is in the laboratory setting. Next slide, please. When we're talking about toxic use reduction, it is different than just pollution prevention. There's a mixture of things, but when we're talking about it, we're really talking about the upstream process of it, reducing at the source. And there's multiple ways of doing that. You could do chemical substitution, and that could be like a one-to-one replacement where it's an easy drop-in option, reformulation, technology change. So maybe you are switching to a different type of equipment that makes it easier for your process, or just a whole process redesign, which can be a lot harder. And then material use reduction can be another area as well. So just so you understand, when we're talking about TUR, or toxic use reduction, we're really talking about, let's focus on that source reduction area, which is most preferable. Next slide. As I mentioned, I help with managing the laboratory here at Turi, and these are just some of the services that we have. So for those of you who are in Massachusetts that may not be aware, you have access to free laboratory services. So as you're looking for safer alternatives and you're stuck, you can actually reach out to us. We can do performance testing to identify safer options for you. And I'll give you contact information on how to reach out to us. But we also offer third-party performance testing for different eco labels, Green Seal, eco logo, and safer choice, or for marketing claims. So we really understand what products are going on the market, and we really try and help vendors be able to find safer alternatives. Today, I'm going to be talking about more of the section, which is our site visit, because those are kind of the questions that you should be asking to look at for moving forward to options identification. Next slide. When we're talking about cleaning, sanitizing, and disinfection, I just want to really clarify, because I feel like these terms sometimes get pushed together, even like when we talk about an umbrella aspect of, all these products, we tend to say cleaners and kind of shove in sanitizers and disinfectants, even though they're not doing the same thing. So when we're talking about cleaning, cleaning is removing, that dust, dirt, any of those contaminants that are preventing us from reaching microorganisms, but you could be actually removing some microorganisms as you're wiping and removing. For example, I put down here like a microfiber cloth and an all-purpose cleaner, and we're really trying to remove that initial dirt, grime, whatever is on that surface. And you can look for eco labels for Safer Choice, Green Seal, and Eco Logo. What today we're talking about specifically is sanitizing and disinfection. When we're talking about sanitizers, we are reducing the amount of bacteria specifically on a surface to a safe level. What that safe level is really dependent on, if you're following certain protocols or standards that you need to meet. But it's usually, it's following that product label, ensuring that you're doing the wait time or contact time is what we call it, for whatever the bottle says for the organisms of concern. And it usually contains, well, it doesn't usually, it contains an active ingredient that has to be registered through the EPA. So you'll actually see an EPA registration number usually on that bottle, and it will provide more information on that, on what it can actually be able to reduce. When we're disinfecting, we're actually killing, and it's usually a broader scope of microorganisms. So it could be bacteria, viruses, molds, and other types of microbes that we are concerned about. And again, that contact time is really important, and ensuring that we know what we're using that product for, and not just picking one and hoping it does a broad range because it says disinfectant. So next slide, please. And these are just a couple examples of some of the chemicals of concern to avoid in products that we've really kind of tried to guide people away from. It's interesting because we do have PAA on here, and I know that that can be a recommended safer or like active ingredient under EPA, but what we have been finding, we were just talking about asthmagens, but a respiratory sensitizer, we're finding that this combination can cause respiratory issues over time. So we have been trying to guide people away from that one particularly. But one I'm definitely going to be highlighting, which has become a bigger topic nationally, in discussion when it comes to antimicrobials, are quaternary ammonium compounds, also known as quats, because we find them both in cleaners and also in sanitizers and disinfectants for different purposes. Next slide. As I mentioned, quaternary ammonium compounds, are all referred to them as quats, have multitude of different functions, and there's a reason why we use them. They're cost effective, they're stable in formulations, they don't have a strong odor, and they usually leave a residual activity on the surfaces. But as a cleaning agent, it uses the surfactant, and it's an active ingredient in usually sanitizers or disinfectants. And these are the most common ingredients that we tend to find. But that residual activity doesn't stop just because we're using it as a surfactant. It really is dependent on the concentration in the product as well. But this has been an ongoing emerging chemical class of concern that we're trying to move people away from. Next slide. And I kind of just talk about here. Oh, next slide. Yep. Sorry. Um, So as I mentioned, quats, we're finding a lot of emerging health concerns, which, range from asthmagens to we're seeing potential impacts on, reproductive, mitochondria impacts. So there's a lot of things going on that we're trying to research and understand more fully. But the reason why I bring up other things to consider is I'm sure you've probably seen on the market a lot of times these two-in-one cleaner disinfectants. And the reason why I've been trying to guide people away from them, as convenient as they can be, it tends to lead towards the potential for risk of misuse. Because if you read the back of these bottles, you actually have to clean first and then sanitize or disinfect or whatever it's going to be in that application. It's really important to follow those instructions. And many of us, if you talk to them, they'll tend to use them and just kind of use it once, call it a day, and not even follow the contact time needed. And a lot of these ones are actually meant for non-porous surfaces. So we're talking about hard surfaces and not porous soft surfaces, which has an impact on its efficacy as well. And I always try and say when you're choosing different products as well, it's like you need to understand what you're working with. And if it's not giving a full ingredient disclosure, unless if you can work with the vendor really understanding what's in it, I try and avoid those just because we can't make a really in good faith decision of whether or not it's a safer alternative if we don't know all the information. Next slide. So these are just an overview. I know we're talking about sanitizers and disinfectants, but I also wanted to highlight, so when you're seeing eco labels and specifically like the Safer Choice program, which does have design for the environment in it, when we're talking about sanitizers and disinfectants that are registered under that program of eco labels, design for the environment is what you're looking for. That is specifically for registered EPA sanitizers and disinfectants that went through that process to get that certification. So if you are looking for a safer sanitizer and disinfectant, you really want to be looking for that DFE or design for the environment as your logo to look for on the bottle. But just because it doesn't have it doesn't mean that it's not safer. It could have safer ingredients or safer actives as well. It's just more of they went through that process to be able to make it more easily identifiable for you as well. And these are just some of the DFE active ingredients that we have been finding to be safer of what we've been looking at. So hydrogen peroxide, citric acid, lactic acid, ethanol, isopropyl. Chitosan was added in 2019. I haven't really seen many like products on there. That tends to be more antimicrobial surface films that we see as well. And I know some people were questioning about hypochlorous acid or HOCl. That is another one that we have been looking into and doing a lot of research here at Turi as well. And you can see I mentioned devices, which devices aren't registered through the same EPA registration process as you would with chemical antimicrobials. But it's something to consider. We actually have some case studies for like a karate gym, for example, that switched from a quat-based product for disinfecting to a dry steam cleaner, which uses less, it has less condensation, and it can be a little bit better for specific applications that you don't want it to get super wet or you're concerned about it destroying a surface. So you could also consider these options too. And same with the electrochemical activated ECA water devices. So some of them come in larger industrial size generators to even like smaller at-home ones. And these tend to use either it could come in a capsule that has a solution that you add to water, you electrolyze it, and it creates a solution that many of them claim is hypochlorous acid. We can't actually test to see whether or not it is like for sure generating that. There is a pH scale to which we understand. We've been looking into it, and what I've been finding with our own research and checking out these different devices is if you use just salt and water base, you're really not generating hypochlorous acid. You're most likely generating more of a sodium hypochlorite, which is like bleach kind of is the brand term name of it. So you really want to look for ones that are using a like a salt vinegar, some sort of acid adding to that salt base to really generate hypochlorous acid. But just to know, hypochlorous acid is not stable. So it's something to know that it does degrade over time. Um, but yeah, if it comes in a validated capsule or packet, if it's a chemical that you're adding to it, that is registered through the EPA registration process. For example, like Force of Nature is an example of a company that has a capsule that they provide. Next slide. These are key performance attributes that we actually go through when we're going to a site visit. So say if I'm going to your location, these are the things that we ask ourselves to be able to identify safer alternatives, whether that be cleaners, sanitizers, or disinfectants. So we look at the practical use of it, which Emily kind of really alluded to as well as part of her process, technical fit, again, resources and economics, health and safety, and then environment and policy. Next slide. For practical use, if I am going on a site visit and I like to look to see how people are using it, not just talking to the decision makers, but also the workers. I think that's really important for you to get stakeholder information from the workers. They're using it on a daily basis. They know how it's actually being used, and you can really get some great insight into how, how it's do they have little quick tips or are they not putting in that time frame? So things to ask yourself is like, how long do you have to perform that task? We think about, talking about gym settings, someone was asking about really kind of highlighting gyms, and that's an area I've been looking at is think about those wipes that you see at the gym settings. Some of them are disinfectant wipes and they're being placed on the surface and they may have a contact time of 10 minutes. But if you've been to the gym, many of us, just quickly wipe down and then leave it and then go instead of actually, some of them may even need a rinse step, but we're not doing that. So it's really understanding like, how much time do you have? Do you really only have 30 seconds or do you have 10 minutes to really wait to let it stay wet on that surface with what you're trying to use? How often are you needing to use it? Are you just doing it just because you think that's the best practice of being able to use it often, or do you have a standard that every time you do a specific task, you need to use it? Could you clean first and then wait till end of day to be able to sanitize or disinfect? So those are kind of the things to ask is like, how often are you doing it? And if you're misusing it, what does that mean? And then contact time requirements. I kind of mentioned that a little bit is you don't want to pick a product that, especially for an organism of concern, that you want that product to be able to, either reduce or kill if you're not going to be able to meet that contact time. So again, like 30 seconds versus 10 minutes, because that will impact efficacy, but also increase the risk of microbial tolerance to that active ingredient. Ergonomics as well is something that I like to look at too. If you're going to replace a process, think about how people are using it. If they're constantly having to, hit that spray bottle, hitting different areas and wiping it down, I mean, that could cause a lot of ergonomic hazards, especially maybe carpal tunnel, repetitive motion, like thinking of those things. So when you're trying to pick products, there's an opportunity to also think about the worker health itself and reducing those potential physical hazards. Training and ease of use. You're not going to want to pick an alternative that maybe, people aren't comfortable diluting their own chemicals and you want to buy concentrate, or you have a risk of people misdiluting it. Maybe it makes more sense to do ready to use, or maybe having, how easy is it for it to be adopted? And then also acceptance. That kind of goes back to getting that input from the workers. You could switch, but if they don't like the process or they don't feel like it works well, they're not going to use it properly. And you're causing frustration around everyone that comes into contact with that product. Next slide. For technical fit, that comes when that relates to more of like the effectiveness of it. So, as I mentioned, thinking about the organisms, but also is it doing the job that you want it to do? And does it work with the materials that you're using it on? Are you planning to do a spray? Is it a wipe? Is it, just like an immersion process? What are you doing with these products? Does the surface, is it approved for that surface area? Does it work? Or is it going to be only for hard, non-porous surfaces, but yet all of your stuff is very porous? Maybe I think of at the gym settings, for example, or yoga studios with their foam blocks. You spray that on, but those are very porous and the chemicals are going to get in there as well. And maybe it's not doing the job that it was meant to do. And also just the infrastructure as well. So, having where you need to place them. Is it easy access? Do you have space for the equipment if you're going to have a automated system for diluting for you? Like, do you have that? And also stability and shelf life and scalability. So when we're doing, for example, in the lab doing performance testing, if we were trying to find you a safer alternative, it's great if it works in the lab, but we want to make sure it works in practice. And also understanding that just because that option works in one setting, even if maybe, again, going back to gyms, for example, I could have a commercial gym that is huge, maybe it's 2 stories, 3 stories, where someone else maybe have a small mom and pop shop. That alternative for the mom and pop shop may not work for the commercial size one as well. Next slide. For resources and economics, I think it's really important to look at what has been done, why you're using it. So we were talking about the pandemic and, a lot of adoption of these sanitizers and disinfectants that kind of kept going. And it's one of those questions of, do we even need to use it? Or could we just use it on high touch surfaces? Like, where is it appropriate? And really understanding the why behind what you're using. And if there really are regulations or guidance that you need to follow. For example, right now, what I'm finding with gym settings is that there really isn't that good of guidance. We're doing stakeholder informational conversations just to understand, what they have to do, what they have to meet. And every place kind of has their own answer to that. Some are saying, well, the members tell me what they want. So I kind of do that. Or they'll say, well, CDC just says I have to use something for MRSA. But it really doesn't. If you look at what CDC says, it's sort of like if you're concerned about that, here's what you could look for, which is for EPA, it's list H, for example. And even here at UMass Lowell, we're working with the rec center here to look at their sanitizers and disinfectants. And that was something that they were concerned about. So really understanding like why you're using that product. And also with direct costs, like understanding for finding an alternative of what you're using, like what are the costs that are going to be, but what can be helpful, especially if you have a product, maybe a safer alternative is more expensive. But you can look at the other hidden costs, like maybe you're reducing worker sick days that you can't see. You're not having to buy as many personal protective equipment or gloves because it's more compatible or has less hazards related to skin exposure or inhalation exposure. And sometimes even there could be like reduction in insurance, health insurance specifically, if you are using safer products. So you can kind of look into that as well, especially for like compliance and waste of where you can save money, even if something may cost a little bit more. And also what's really important too is, and what we think about as well, is you don't want to pick a product that is being marketed as this amazing safer alternative for sanitizing disinfectant. And maybe it's availability, it's one company. And if they go out of business, you're kind of out of luck because if no one else is manufacturing it, now you don't have that source anymore and you have to rebuild your entire process again to look for something else. So really ensuring that your supply chain is capable of upkeeping that, or there are similar products that you could look at for drop-in replacements if something did happen. Next slide. So this is kind of just talking more too about what we think about for quantitative measures and qualitative measures too. So just thinking about, when you're looking for safer alternatives, here's some options for how you can look at savings, where they can come from, sort of what I was already talking about, but this kind of breaks it down a little bit more about those hidden costs that you might want to think about. Next slide. For health and safety, this kind of goes into what Emily was talking about, really thinking about the worker exposure potential, but even I was just talking about gyms. I mean, the people who are doing that type of work, for example, for sanitizing or disinfecting, tend to be members who aren't even trained to use that. So thinking about everyone in that whole process that might get exposed to these chemicals if they are misused or overused. Also thinking about your personal protective equipment, requirements versus actual use, and understanding what is appropriate and what isn't a burden to the actual workers as well. Can you pick something that isn't going to cause them to have to wear a ton of personal protective equipment that could cause other issues like dermatitis because maybe they're constantly wearing that, and just comfort level as well. And I've already mentioned the worker agency. I think that's really important. Equity too. Training your workers to be able to identify or look at products and question that, I think is really important too, because you could pick a product, but if you're not teaching them about the why behind it and like why we're using it the way it is, why contact time is important, you are kind of keeping them from that conversation of giving you real feedback on whether it's working in practice, and it allows them to be able to gain skill sets that could allow them to thrive further, maybe in that field or in that position, to be able to make really unique decisions about finding safer alternatives. And especially for that environmental justice aspect, we've been finding a lot of products that tend to be, especially for those who buy locally, just maybe a company or a business might go to a local dollar store or Target or wherever they're going. Do they have access to safer alternatives, especially if it's in an EJ community, or just exposing those around you to those chemicals as well? Next slide. And this kind of just goes into, other things we think about. So environmental fate, what's happening to your product, really thinking about circular economy, the type of packaging, if that's important to you as well. Maybe you want to have tablet form because now you're not dealing with as many plastics. You can really think about waste reduction as you're choosing safer options. And also, I think even talking to OSD too of what you'd like to see for products as well. Especially for meeting those types of goals, I think it's helpful for us to know what end users are needing so we can also advocate as well. Knowing what your regulations are extremely important, and not just what you were told, but really understanding, what do you need to follow? What are you concerned about, and what are you trying to address, especially when using sanitizers and disinfectants? And if you don't know, that's something, definitely feel free to reach out to us or, other groups here on a state or local level to be able to find out, what do you need to follow? And also thinking about essential use. So again, high touch surfaces when it comes to sanitizing and disinfecting, and not just using it just because we're concerned about everything because we don't even know if it might be working properly. Next slide. Emily kind of briefly talked about this in one of her slides. So we at Turi have a Cleaner Solutions database. So it's cleanersolutions.org. And this is our publicly available free database that we're constantly updating and always looking for feedback. But all of our performance testing is here and available. And we use this as a method for people to be able to try and find safer alternatives or know what's on the market. And we've worked with Julia to be able to put all the FAC 118 cleaner sanitizers and disinfectants into here. We may not have performance testing yet for all of them, but you can find them through here. And we were looking at health and safety as well. But next slide, please. We are currently trying to update the database as well to be able to make it easier for you to search those FAC 118 sanitizers and disinfectants. We have it by search by eco label. So I saw, someone had mentioned in the chat for the DFE, you could actually search that way as well, but the FAC 118 has it on there. But we're trying to update too for our contaminant section that you can search by, or what you're trying to remove is organism of concern, and also trying to work with vendors to really understand what are the substrates that could work with it. So this is an ongoing project. I'm hoping to have updated, at least have the base information by midsummer. We're currently working on it, but product profiles will have like the organism claimed. We're trying to make it easier for you to find the actual registration document that was submitted through EPA on that product, so you can really dive into it. The safety data sheet for it, technical data sheet on how to use it, and also try and list some of the compatible substrates, but you'll eventually be able to see that. Future goals for this is also to have a contact time search, which could also work for process too in general, not just contact for an organism, but even just finding a cleaner for whatever time period that you need, and also look maybe by sanitizer disinfectant category. Next slide. So this is kind of what we have right now as a screenshot, so you can kind of see recommended contaminants. We have the different organisms on here. We're trying to figure out how to put in and working to be able to update that so it will actually have contact time in there too of what's listed. But you can kind of see there, right now it says MSDS, TDS, we're updating that, but right there, for example, it has EPA registration documents. So that way you can find all the information or other names that that product is being listed under. Next slide. So these are just additional resources for, a whole plethora of not just sanitizers and disinfectants, but if you're ever looking for safer cleaners. We have done a video that I did on basically what I talked about, but really great if you want to just share with others on how to talk about, what are areas of concern. A quat fact sheet, which I believe someone had asked you about whether quats are going to be Tura hazardous chemical listed. So it's recommended for listing right now. We're waiting for response to public comments. And if you have questions, feel free to reach out to Heather Tenney. That's Heather_Tenney, TENNEY at uml.edu if you have questions regarding our Tura listing of certain chemicals, and just some other resources here that may be helpful for you. Next slide. Thank you so much. And with that, I am going to pass it over to Julia.
Great. Thank you so much, Alicia.
Welcome.
I always learn something from you. Thank you for navigating safer sanitizers and disinfectants for us. So now we're going to dive a bit into our FAC 118 contract. And before I hand it over to Tatiana, I just want to expand a bit on Executive Order 515, which really has allowed us to develop an all-green cleaners contract. Next slide, please. So I mentioned earlier about Executive Order 515, that it formalizes our EPP program and creates really a mandate for agencies to purchase EPPs. And our broader goal includes maximizing the number of EPPs on all of our contracts, setting minimum environmental standards, providing training and outreach, which is exactly what we're doing here today. And we also submit an annual progress report, which we just published, by the way. And there's a link here to the progress report. I also co-chair the Toxic Reduction Task Force, which includes Emily, which includes Alicia, and other representatives from other agencies in the Commonwealth. And the task force works to identify chemicals of concern and promote safer alternatives. And sanitizers and disinfectants have been a primary focus since the executive order was signed in 2009. So I just wanted to give you a little bit of that background. So with that context, I'm going to turn it over to Tatiana to walk us through our FAC 118 cooperative contract. Tatiana.
Hello, hi everyone. Thank you so much, Julia. Hi everyone and welcome. For FAC 118, FAC 118 is considered our green contract, meaning it's all the product in that contract are environmentally preferable cleaning product, program, equipment, and supplies. This is a multi-state contract It's created in conjunction with Connecticut, Maryland, New Hampshire, New York, and Rhode Island. The products under statewide contract is all green chemical and janitorial paper product that are independently third-party certified through either Green Seal, UL Ecologo, US EPA, Safer Choice. And this contract contains safer sanitizers and disinfectants. Sales on this contract is more than $20 million per year, and that's among all 6 states that are participating on the contract. The current contract term is from March 1st, 2022, and it goes to February 29, 2028. And there's an option to renew for 2 more years till 2030. Next slide, please. For safer sanitizer and disinfectant, we have a list of prohibited ingredient for our safer sanitizers and disinfectant. Those prohibited ingredients include chloride bleach, hydrogen chloride, phenol, pine oil, quaternary ammonium chloride compound. So any product that contain any safer sanitizer and disinfectant that contain those ingredients are not allowed to be sold under the FAC 118 contract. And for accepted ingredient, active ingredient, we have a list here for you that you can always go by. And then the list include for accepted ingredient, caprylic acid, citric acid, word that I cannot pronounce, I'm not even going to try, ethanol, glycolic acid, hydrogen peroxide, hypochlorous acid, isopropanol, lactic acid, sodium chloride, thyme oil, also known as thymol, and then peroxycitric acid. So those are the acceptable ingredients on our disinfectant and sanitizers, and those are verified. We do verify those when products are added or sold under the contract. Next slide, please. How to find and purchase product on FAC 118. FAC 118 has a contract user guide, and the contract user guide that OSD put together, it serves as a buying guide for our buyers. And on that, it covers how to purchase contract, what are the exclusion of the contract, what buyers are not allowed to purchase under the contract, or vendors are not allowed to sell under contract. And also, it has a list of all the awarded vendors and their contact information if buyers needs to reach out to the vendors listed on the contract. Also, the contract user guide has linked to pricing, a list of all approved product, and also it provides the requirement for quotes for buyers who wish to purchase on the contract. For FAC 118, in combis, for users who are using combis, there is a master contract record for that contract. Under master contract record, you'll find files that contain either the RFR, product specs and requirement, and also there's a master list of all the product catalog for all the vendors. And in that master contract, you'll find product spec, pricing, including discounts on those product, and also third-party certification for every product on the contract. Next slide, please. And here is a list of our eligible purchasing entity who can purchase under the statewide contract. Those entities include state agencies and department, municipalities, and political subdivision, public educational institution, public libraries and hospital, independent public authorities and commission, nonprofit organization, public purchase cooperative, also other states who are currently participating in the contract, and their affiliated entities. Other entities are eligible to purchase on the contract. Say, if they wish to do so, they just have to reach out to OSD for approval. Once they approve and we give them the approval, they are allowed and are eligible to use the statewide contract. Next slide, please. FAC 118 currently have 17 vendors that are approved to sell under the contract. And the list of vendors are listed. And you may also find, like I mentioned before, the vendor contact under the contract user guide and also NCOM buys. Next slide, please. And with that, I will pass it on back to Julia, who will open it up for Q&A. Thank you.
Thank you so much. Thank you very much to all of our speakers. That was fantastic. And we're going to have some question and answers. We have about 9 minutes left. And I see that there's been some questions asked in the chat. Kim had asked a question about tips for getting folks to purchase the correct items off of buying guides. And thank you so much, Alicia, that you're going to think about that. But one answer, if you are within Massachusetts, we recommend using FAC 118. We have an approved products list. It's literally a list, and they can only purchase products that are on that list. And we have vetted all of those products so that it makes it easy for the buyers. And that was really one of the big points of doing it the way that we did. So if you do go into Combis and you search on FAC 118, it's in the master contract record, and it's called the FAC 118 approved products list. So that's one thing. Let me see here if there are.
Julia,
Yes.
thanks so much for bringing that question up. Yeah, I'm actually not in Massachusetts, but I'm curious, does that process have like links to the cleaners? Because so the problem that we have, I work for a county and I'm supporting a housing authority, and they have like a buying guide that has the approved products.
Mm-hmm.
But folks, like actual workers, will go and try to buy the product. Maybe they try to buy it from Amazon or somewhere else,
Right.
and they don't buy like the specifically correct one. So I'm curious, how does Massachusetts that process? Is it like a link to a website where they buy it, or how do you make sure that they're actually buying that right one? Does that make sense?
Yeah, I mean, we have catalogs that each of our vendors maintains. They also have something called punch outs. So it punches out from our system to the vendor's system, and you purchase the products through there. Then it comes back into our system. But I hear what you're saying, that you want to make sure that the product that's listed is the one that they're actually going and purchasing. And one of the thoughts is that you have the right stock keeping unit number or the manufacturer identification number. And that usually narrows it down. The stock keeping unit number might be a vendor number and not the manufacturer's number. So often I ask for the manufacturer identification number. And if you request that, you're going to usually get the right product.
Sure. But
Yeah.
I think,
And
having the vendor take responsibility is an interesting idea. Helping them to establish sort of a vendor relationship versus having folks just go and buy the products from Amazon or Home Depot. Because I can imagine asking someone to go look for a product by the SKU number versus the product name off of the shelf at Home Depot would be a barrier.
It's hard. Yeah.
Kim, I can add, so if they're going to Home Depot, for example, like, so what we'll do sometimes, because that's an issue that, so we work with students here at Turi, so I'm training a multitude of backgrounds and trying to get them to understand how to identify products. I think also having an image available too, and maybe that's something a discussion is like, what does the product actually look like? But if we're talking about sanitizers and disinfectants, like I mentioned, they need to have an EPA registration number that ties it back what they could actually do because they will show up on the profile of like at Home Depot. You could put that product, put the EPA registration number that should be provided for that one, and then find an image of it, but if you go on like Home Depot, for example, if you type it in and look for that local area, it will tell you the aisle and location, and now they know what it looks like. So that might be a way. I find visuals are really handy, but if we're talking about sanitizers and disinfectants compared to cleaners, that registration number is so handy because it's only identified for that product.
Yeah, great. Thank you. We had a couple of other questions that I just want to get to in our couple of minutes that folks had submitted earlier. So one of the questions was, do hand sanitizers lead to cancer? And Alicia, I think you were going to answer that one.
Yeah, so we were talking about this, and what I have been seeing is it tends to be something related to like the ingredients in it may be degrading into something. But the thing that you have to remember too is it really is dependent on what we're talking about. So FDA actually shared a list, and it was from specific vendors. I think it was outside of the US that were coming in, and you can find it online if you look up like FDA, sanitizers, cancer, or look those up. Um, they have a list, and that was the issue was people were kind of producing them, and they could have had extra ingredients in them that could have been caused. And that's from what I could see on that. But I think it's really important to also talk about how hand sanitizer should not be your first line for we'll talk about cleanliness because it's not meant for cleaning. It's supposed to be that backup use of it. You should be cleaning first, washing your hands with soap and water because that is extremely important. Does a wonderful, effective job. You can look up studies on it, but I understand like worst case scenario hand sanitizer. So like looking at making sure that you're picking something that maybe has like isopropyl or ethanol, because some of them have quaternary ammonium compounds in them too. And we were talking about avoiding those ones if you're worried about health concerns. But I think just really reinforcing that you should be washing your hands first and using that as the last line and not constantly using hand sanitizer. I know in the workplace we see it constantly everywhere, and that tends to lead us to want to just press that instead of washing our hands, but it does not replace what soap and water actually do in practice. And I know it doesn't fully answer your question, but I hope that kind of helps too.
Great, thank you. So why don't we try for one more? We had a question that was posted with the registration. How do peroxide-based chemicals affect a facility?
I would love to know more context of like the facility and what you're I don't know who asked that question and hopefully that they're here. Is the person who asked that question here by any chance? If not, if we're talking about hydrogen peroxide, if we're talking about like how it could affect facility, I think it's more of going back to what I was talking about of making sure that those products work on the substrates that you're using, and also the contact time. So really understanding why you're using it and if it's compatible with your application and needs. And that could be just a talk with the vendor of whatever surfaces that you're trying to replace, or even talking to that vendor of hydrogen peroxide. But I know we have been looking into hydrogen peroxide just from use and just seeing what do those exposure levels, does it contribute to asthma? It's something on our list, but it's just something to think about with any of these cleaners, sanitizers, disinfectants, really understanding how often you're using them, who's being exposed, what like type of environment are they using it in? So are they in an enclosed space constantly with no good ventilation? Of course, their exposure is going to be a lot higher risk compared to someone who is doing it in a well-ventilated area that is constantly has airflow turnover, or maybe they're only using it occasionally. So I think just being aware and going back to understanding the purpose of that product, what is it being used for, and is it compatible with your application? Feel free to reach out if you're ever curious if it's appropriate for your application.
Great, thank you so much. Well, we are 2 o'clock, and I want to thank everybody for participating today. We will be sending out the slides and a copy of the recording of this presentation that you could share if you'd like. And if you have additional questions, please reach out. We are all here to help answer any of the questions that you have. So once again, thank you very much, and have a great day.